Hi, my name is Rachel Park, and I'm an optometrist at Spectrios Institute for Low Vision. Today, I would like to talk about eccentric viewing, which is an important technique used by individuals who have lost their central vision due to an eye disease affecting the central part of their retina called macula. People with central vision loss have difficulty seeing details in the central part of their vision, which makes recognizing faces, watching television, looking at photographs, or reading very challenging tasks to do. After some period of having central vision loss, many people naturally realize that they can see better when viewing peripherally, and that is possible because they are now utilizing a non-central part of the retina that hasn't been affected by an eye disease. And that part of the retina will be called preferred retinal locus, or PRL. The problem with individuals who figure out eccentric viewing on their own, they sometimes may not select PRL that is optimal for visual function, so their eccentric viewing position is unstable. So for next few minutes, I would like to provide you a simple tip to help you figure out an eccentric viewing position that works the best for you. As an example, I am going to use a picture of my family dog. Usually when someone looks at an object of interest, in this case a dog, one looks centrally as long as the macula is healthy. However, when a person has a damage to their macula, they may notice a blind spot or distortion in the center, as an example shown here. They are not able to see an object of interest in its entirety. Also, note that a central blind spot may have an uneven shape. So how does one select the best preferred retinal locus or the best eccentric viewing position? The most common and the easiest method is a clock face method. Imagine a clock as shown here. When one moves their eyes toward a particular clock hour, for example, at 12 o'clock, they also move the blind spot away from the center, which would allow them to see the object of interest that was previously unseen. We usually assess minimum of 4 clock hours, starting from 12 o'clock, then to 3, 6, and then lastly 9 o'clock. So I'm going to demonstrate the clock face method using the picture of my family dog. Let's assume that you have the central blind spot. When viewing centrally, you're not able to see the dog's face in its entirety. Let's start by looking up toward the 12 o'clock. As you move your eye, the blind spot follows your eye movement, which reveals the dog's face that was previously not visible. Now let's look toward the 3 o'clock. You can notice that the blind spot also has moved and is at a different location than when looking at the 12 o'clock. Now let's look toward the 6 o'clock. Finally, look toward the 9 o'clock. Based on the clock face method, you could determine that you see the dog's face the best when eccentrically viewing toward the 3 o'clock. This would be your PRL, preferred retinal locus. This viewing position could be used for viewing any other objects of interest, such as a television screen, a family photo, or your friend's face.